Hello everyone, Dr. Medad here. Today we'll talk about point-of-care ultrasound color Doppler. Our objectives are, what is color Doppler and what do we use it for? Color Doppler are sound waves to measure the movement of blood cells, and it uses the Doppler effect to tell us the direction and velocity of blood flow in real time. Red means it is towards the probe, and blue means away from the probe, and a mnemonic to remember that is BART. Blue, away, red, towards. And the lighter shades of each color indicates higher velocities. Color Doppler can be used to tell blood flow within the heart chambers, valves, and major vessels. It can tell us if there's valve regurgitation or stenosis. It can show us intracardiac shunts, and if there are any abnormalities in cardiac wall motion. To use color Doppler on ultrasound, first you obtain the cardiac window and the region of interest, then select color Doppler on the ultrasound, then you move the color Doppler box to the region of interest, as shown in this picture. This is the RV, this is the LV, this is the RA, and this is the LA. Here is the mitral valve, and this is the apex of the heart, also where the ultrasound probe is pointing towards, and it looks down. This is a normal heart in apical 4-chamber view, and remember BART, blue away, red towards. As you can see here, when the heart is in diastole, you see the color flow going towards the apex, where the ultrasound probe is. And that's indicated by the color. As the heart is in diastole, the color flow is orange. So that's going towards the probe. And you can see that there is no backflow because you don't see any blue going backwards. Therefore, you can tell that there is no valve regurgitation. In this case, this is the mitral valve, so there's no mitral valve regurgitation. Here we have the apical 2-chamber view, and it's showing exactly what the 4-chamber view is showing in terms of color Doppler. In diastole, the color flow is going towards the apex of the heart, where the ultrasound probe is, so it's in color orange, and there is no backflow because we don't see any blue. So there's no valvular regurgitation. In summary, today we talked about how color flow can tell us the direction of blood flow, and we use it to evaluate valve regurgitation or stenosis or intracardiac shunts. And we talked about the mnemonic BART, blue away, red towards, and that is in relation to the ultrasound probe. If you thought this video was helpful, please like and subscribe and look out for my next video. Thank you for listening.